All right, everyone. Get ready for a deep dive into something pretty wild.
Yeah.
We're talking about pituitary incidentalomas.
Ooh, intriguing.
You ever wonder what's going on up there in your brain?
All the time?
Imagine this. You go in for a scan for something completely random, like a sinus thing,
Okay.
and bam, they find a tumor in your pituitary gland.
Whoa.
Yeah, that's a pituitary incidentaloma.
A tumor just hanging out.
Until someone accidentally finds it.
And the crazy thing is,
Yeah.
they're way more common than you'd think.
Really?
Studies show tons of people could have one and not even know it.
Okay, now I'm really curious.
Right.
If they're so common and people don't know, should we be worried?
That's exactly what we're going to figure out in this deep dive.
Okay.
See what they are, how they're diagnosed,
Yeah.
and most importantly, if you need to do anything about it.
Right, I'm all ears.
Great.
Let's start with the basics.
Sure.
Just how common are these things?
Well, research with both autopsy and imaging studies show they're not that rare, although it does seem like how they're detected makes a difference.
What do you mean?
Well, the type of scan used can affect how often these incidentalomas are found.
Oh, interesting.
CT scans pick them up in some cases,
Yeah.
but MRIs seem to find them more often.
So some incidentalomas are harder to see than others,
Yeah, it could be that they vary in size or something.
making them harder to spot.
Right, and also,
Okay,
people referred for more in-depth evaluations often have larger lesions,
interesting.
which are more likely to cause symptoms.
So if someone has symptoms, their incidentaloma is easier to see.
Exactly. Like if it's tiny, smaller than a pea,
Gotcha.
it might not cause any issues.
And go unnoticed,
But if it's larger, it could press on the brain.
leading to more investigation.
Right.
But you said earlier that not all incidentalomas are pituitary adenomas.
Oh, you're right.
What else could they be?
There are other things that could look like a pituitary tumor on a scan.
Like what?
For example, a Rathke's cleft cyst.
What's that?
Basically, a benign, fluid-filled sac.
So not a tumor.
Right, so it's super important to figure out what we're dealing with.
I see. So how do they know if it's an adenoma or something else?
It starts with a thorough evaluation.
Okay.
This usually involves physical exams, medical history, and some additional tests.
To see what's going on.
Yeah, to check hormone levels and get a clearer picture of the incidentaloma.
Okay, so someone has one of these incidentalomas.
Hmm.
What happens next?
That's where things get a bit tricky.
Okay.
It really comes down to the size and behavior of the incidentaloma.
You keep saying size matters.
It really does.
So how does the approach differ depending on the size?
Well, for those bigger incidentalomas, it's similar to how doctors manage other pituitary tumors that cause symptoms.
I see.
They'll want to monitor it and run tests.
To check on things.
Yeah, to make sure your hormones are balanced and it's not causing problems.
And what about the smaller ones, the ones without symptoms?
For those, the approach is usually more conservative.
Like waiting and seeing?
Exactly. Doctors will probably recommend monitoring it over time.
To see if it changes.
Right. The good news is
Yeah.
most of these incidentalomas, especially the smaller ones, are harmless,
That's good to hear.
and they don't need immediate intervention.
But I'm guessing sometimes treatment is needed.
Yes. In certain cases, treatment might be recommended,
Like when?
especially if it's large, growing, or causing problems with hormones or vision.
Okay, so we've established that not all incidentalomas are created equal.
Definitely.
And their size plays a big role in how they're managed.
Absolutely.
But I'm curious, do these incidentalomas just stay the same size?
Good question.
Or can they change?
It's really important to understand how they behave over time.
To make decisions about them.
Right.
So what do studies show about their natural history?
Well, research suggests many incidentalomas stay stable,
Okay.
but some can grow.
Hmm.
There was a study that followed a lot of patients.
With incidentalomas.
Yeah. And they found that in some cases, the masses did grow over time.
Wow, so even if they're not causing problems now,
Yeah.
they could become more serious later on.
That's why regular monitoring is so important.
Especially for the larger ones.
Exactly. Or ones that show any signs of change.
This has been really insightful.
Good.
We've covered a lot.
We have?
From how common these incidentalomas are
Uh-huh.
to the fact that their size is important for figuring out what to do.
And we've only just scratched the surface.
Oh, there's more.
There's so much more to explore,
Right.
like how they're treated and what the long-term implications are.
Okay, well, I'm ready when you are.
Let's take a moment to let all this sink in first, though.
That's good. Okay, so before we pause,
Yeah.
we were talking about how some of these incidentalomas might need a bit more than just watching and waiting.
Right.
Let's talk about what those interventions actually look like.
Well, when it comes to treating pituitary incidentalomas, doctors really personalize it.
Okay.
They look at the size, the type, if it's affecting your hormones, any other problems.
And your overall health, I'm guessing.
Exactly.
So each case is unique.
Definitely not one size fits all.
So for some folks,
Yeah.
especially if they have a large incidentalloma,
Huh?
that's affecting their vision,
Or pushing on other parts of the brain.
surgery might be recommended.
Yeah, sometimes observation isn't enough.
Surgery inside the brain.
It might sound scary, but it's minimally invasive.
Okay.
It's called transphenoidal surgery.
What's that?
They go through the sphenoid sinus, behind the nose.
So they go through the nose to get to the brain.
It's pretty amazing.
That's why.
And they don't make any incisions on your face or skull.
Wow, so they just remove it through the nose.
Remember how we talked about hormones?
Right, some incidentalomas can mess with your hormones
If that's the case, they might need hormone replacement therapy.
after the surgery.
Yes, to supplement the hormones that aren't being produced naturally.
I see, to keep everything balanced.
Exactly.
So we have surgery to remove it and hormone therapy to balance everything out.
It's a comprehensive approach.
But not everyone needs those interventions.
Right, especially the smaller ones.
They're usually fine with just checkups.
Yeah.
So most pituitary incidentalomas are harmless,
And just need to be watched.
but some might need surgery or medication.
Especially the larger ones or those causing problems.
Early detection and proper management are key then.
Absolutely.
That's why these incidental findings should always be checked out by a doctor.
Even if they seem small.
This has been so eye-opening.
I know, right?
It's amazing to think that something like this can be in your brain without you knowing.
It really shows how complex the human body is.
And how important it is to stay informed about our health.
For sure.
But this conversation has me thinking,
Oh, what about?
what if brain imaging was routine for everyone?
Interesting thought.
It could lead to earlier detection.
Of incidentalomas and other things?
It could change healthcare.
It's a fascinating idea.
But with that comes new challenges.
Like what?
Well, should we be scanning everyone's brains?
Even if they don't have symptoms.
It's an ethical question.
There's also privacy to consider.
And how would we even do that for everyone?
It would be expensive and complicated.
And does earlier detection always mean better outcomes?
It could lead to overdiagnosis.
And unnecessary treatments.
It's a complicated issue.
It seems like we've stumbled onto another topic for a deep dive.
I agree. It's something that needs to be discussed more.
But for our listeners who are concerned about their health right now,
Yes.
the best advice is to talk to their doctor.
Absolutely. Personalized healthcare is always the best.
As we wrap up our exploration of pituitary incidentalomas,
Yeah.
I'm amazed by how a simple topic led us to the future of healthcare.
It's true. It's really made us think about technology, ethics, and individual well-being.
Absolutely.
It shows that knowledge is a journey.
And we're always learning something new.
Exactly.
Well said. I think that's a great place to end our deep dive today.
I agree. Thanks for listening, everyone.
Wow, that really got me thinking.
Me too.
It's amazing to think about how technology like that could change everything.
Yeah, like routine brain imaging.
It could be revolutionary, but also challenging.
It really shows how progress can be good and bad at the same time.
Right. The more we learn.
The more we realize we don't know.
And each new discovery brings new questions.
Absolutely.
That's what I love about these deep dives.
Yeah.
It's not just learning facts.
It's about exploring what they mean.
And how they change our understanding of the world.
We started with these pituitary incidentalomas.
And ended up talking about the future of healthcare.
It's crazy how connected everything is.
It's like each piece of information is a thread.
That leads to a whole tapestry of ideas.
I love that analogy.
It's the beauty of learning
Always discovering new things.
and going in unexpected directions.
I think that's a perfect way to wrap up our deep dive today.
I agree.
We've covered so much about pituitary incidentalomas.
From diagnosis to management,
And even the future of healthcare.
it's been a great journey.
For anyone who might be feeling overwhelmed,
Just a lot to take in.
remember, most pituitary incidentalomas are harmless,
And just need to be monitored.
but some might need more attention.
If you're concerned about your health,
Talk to your doctor
they can guide you.
and help you make the best decisions.
Absolutely.
That's all for today's deep dive.
Thanks for listening, everyone.
We'll be back soon with another fascinating topic.
Until then, keep those brains buzzing.
And stay curious.